يعطيكم العافية and welcome all to this lecture about the assessment of drug-related needs. So in this lecture, we are going to talk about the development of patient care process. We will go over the elements of patient care process. We will discuss the components of drug therapy problem and how to identify the drug therapy problems. We will talk about the categories of drug therapy problems, and we will highlight the difference between drug therapy problems and medication errors. In the last part of this lecture, we will go over the medication errors. We are going to define the medication errors, and we are going to discuss the potential measures to decrease the likelihood of medication errors. So let's go ahead and get started with the first slide, which is a scheme that summarizes the development of a patient care process. So here we have the three components that are important in the development of patient care process, which includes the assessment. So I have to know what does my patient want and what does my patient need. In the second part, we have to define and set up a care plan for the patient. So what am I going to do for my patient? How am I going to intervene? And then in the last part, we have to evaluate and to assess in order to know if the interventions and if my plan is actually working for the patient. And as you can see, we need to establish a therapeutic relationship with patients in order to get information or pertinent information about the assessment, the care plan, and the evaluation. So what do we need? What do we mean by a therapeutic relationship? A therapeutic relationship is a professional, established relationship with the patients, which is important to help the patient in therapy to change his or her life for the better. So if we have a professional relationship with the patients, then I can assess the needs and the health status of the patient, and we can set up the care plan in order to improve the life of the patients via different therapeutic options and interventions. So that's why the therapeutic relationship was set up at the top of the three different elements that we need to follow when we are developing a care process for different patients. Besides, it's also important, as listed in the lower part of the slide, to have a continuous follow-up when you are assessing the outcomes after the implementation of the care plan. So we can evaluate if we are having the outcomes or the objectives that we set up at the beginning of the intervention or at the beginning of the drafting of the care plan or the interventions that you set up for your patient. So we will go over to the next slide, which listed the three major steps or elements that we have to follow during the patient care process. In the first step, we have to collect and organize pertinent patient-specific information. So we have to get background information and collect the subjective and objective information that are important to know before we go ahead and move to the second step, which include assessment of the drug-related needs. So in the first step, what kind of information do we need to collect to know and to identify the drug-related needs? Such information that must be collected in the first step include data that can be related to the chief complaint of the patient, the history of presenting illness, past medical history, past surgical history, social history, demographics of the patients. Besides, it's also important to get information related to the medication history, including a history of adherence and compliance with different prescribed medications. In this section, we can also collect information related to the review of systems, vital signs, laboratory measurements, and other diagnostics that were done to the patient. So how can we get and collect pertinent patient-specific information? We can get such information from the patient via self-reporting, or sometimes if the patient, for example, is severely ill or unconscious or not able to provide sufficient and reliable information, we can get the information from the relatives or the family members. Besides, we can rely on other healthcare providers or medical records or electronic resources to get pertinent patient-specific information that are needed to proceed to the second step. In the second step, we are going to assess the drug-related needs for the patient. So during this step, we have to analyze the collected data to determine if the patient drug-related needs are being met. And we have to make sure that all medications and all prescribed medication and all the patient's medications are appropriately indicated, and the most effective available options are selected, and the safest option is prescribed for the patient. Besides, we have to make sure that the patient is willing to voluntarily take the medication, and the patient is willing to be compliant and adherent with the prescribed medication in order to get the setup outcomes or the objectives that we have from the medications or from prescribing different medications. So the measurement criteria, the patient-specific data collected in the assessment are used to decide if the medications are indicated, if the safest options are prescribed, and if the most effective options are actually used in this patient. And then we have to make sure that the patient is willing to be compliant and is willing to take the prescribed medications. So in this step, the assessment step, in this slide, we have the definition of the assessment. The assessment is a systematic review of the patient's drug-related needs. In this step is usually performed by the pharmacist, by which a systematic and comprehensive assessment of all patients' drug therapies, including prescription medications, over-the-counter medications, herbal products, home remedies, and nutritional supplements are reviewed. And such assessment is conducted to determine whether they are indicated, effective, and safe, as we just mentioned in the previous slide. The assessment is the step in which the practitioner makes the clinical decision as to whether drug therapy problems exist at this time. So it is an important step in order to determine and define any drug-related needs. The pharmacotherapy workup is the logical thought process that guides the work and decisions as the clinician assess the patient's drug-related needs. So the third step, which is the drug therapy problem and identification of the DRPs or drug therapy problems, can be accomplished through pharmacotherapy workup, which is the logical sequence or the logical process that guides the work and decisions to assess the patient's drug-related needs. Also, pharmacotherapy workup organizes the interventions that need to be made on the patient's behalf. So in this step, by following a pharmacotherapy workup, you can identify the DTPs. Besides, they can be prioritized. So the most important DTPs can be dealt with initially, and then the least important or the least eminent, the least important DTP can be dealt with later on. So the pharmacotherapy workup establishes appropriate parameters to evaluate at follow-up as well. So we can identify the problem, set up your intervention, and then we have to set up the appropriate parameters to evaluate at the follow-up step to evaluate outcomes of intervention. So this slide lists the drug-related needs of the patient that can be identified via the collection and assessment steps. Drug-related needs during a pharmaceutical care encounter, the patient's medical conditions, and all of his drug therapies are assessed to determine if the following drug-related needs are being met. As mentioned in the previous slides, we have to make sure that the medication is appropriately indication, the medication is effective, and is achieving the intended goals of therapy. The medication is safe, so the patient is not suffering any adverse reactions or experiencing any signs of toxicity. And Lastly, we have to make sure that the patient is compliant, so the patient's able and willing to take the medications. For example, if the patient has problems, if the patient has rheumatoid arthritis and he has dexterity problems, and we prescribe some kind of injectable medications to the patient, or the drugs are dispensed in a container that is a child-resistant container, it will be hard for the patient to open up the container to take the medication. So maybe the patient wants to be compliant with the medication, but he is not able to open up the container to take the prescribed medication. So we have to make sure that the patient is actually able to be compliant and willing to take the prescribed medication. So we have to make sure that that the prescribed medication is appropriate, effective, and safe for the patient, taking into account different components and the clinical status of the patient. So, in the pharmacotherapy workup, the practitioner establishes the connections between the patient's indication for drug therapy, the drug product or the medication used, and the dosage that is actually being taken. And we can connect all those components with the outcomes that result in order to make rational drug therapy decisions. Okay, so through the thorough pharmacotherapy workup, we can identify the indication, the drug product or the current medication that is actually taken by the patient, the dosage regimen that is used by the patient, and then we can identify the connections between those different components. All drug therapy decisions require the three basic types of information. So we need to know information about the patient information. Besides, we have to know details about the medical condition. So we have to know about the disease, the indication of the used medication, patient information, and then we have to know information and details related to the drug. So what kind of drug is prescribed, what is the dose of the used medication, frequency, and duration. These connections begin with the indication. The indication combines patient and medical condition information. So the practitioner must know the indication for each drug therapy the patient is taking. After the indication has been identified, then the information about the drug product and dosage regimen can be assessed in its proper context. Finally, the outcome that resulted from the drug regimen can be evaluated in order to assess for appropriateness. Patients who have comorbid diseases or patients who have several indications may require numerous drug regimens. So each of these drug therapies must be assessed separately to evaluate the outcomes of each. So you have to follow the pharmacotherapy workup for each individual indication and for each individual prescribed medication individually, rather than looking at the cumulative effect of all or of the combined medications together. So you have to review and follow the pharmacotherapy workup for each individual indication and for each individual drug product in patients who are using polypharmacy or patients who have multiple comorbid diseases. The basic structure of the pharmacotherapy workup that was repeated in the previous slides include the four components, which are the indication or the disease, the drug product that is being used, the dosage regimen, and the outcomes. The basic structure of pharmacotherapy workup also serves to identify drug therapy problems of any type in any patient with any disease who is taking any kind of a drug therapy. Drug therapy problems can occur at several places in the drug use process. So it can happen at the level of the indication, and those also are referred to as DTPs. So DTPs can occur at the level of the indication. And this can be in the form of unnecessary drug therapy that is not indicated. At this level also, patients may need additional drug therapy. The patient may have undiagnosed indication, and the patient may not be using an actually needed medication, and this is classified as a need for additional drug therapy. Besides, the patient may have problems related to the drug product itself, where an ineffective drug may be selected or adverse drug reactions may be seen in the patient. Drug therapy problems can be associated also with the dosage regimen the patient is taking. So the drug regimen could be too low to produce the desired benefit, or it may be too high and result in drug toxicities. Lastly, the patient may not be able or willing to take the drug therapy as intended. So as you can notice, all of these drug therapies can be related to the patient or to the different components of the pharmacotherapy workup. It can be related to the indication, to the drug product, to the dosage regimen, or to the outcomes through non-compliance or non-adherence by the patient. The basic structure of pharmacotherapy workup also serves the practitioner to evaluate the effectiveness and the safety of the used drug therapy. This structure applies to all patients with any disease taking any drug therapy. So we can assess the outcomes that are associated with the used drug therapy. So we can assess the effectiveness of the used medication. We can assess the safety of the used medications as well. The effectiveness of the patient's drug therapy is evaluated by comparing the resultant changes in laboratory tests and the changes in clinical signs and symptoms to the patient's goal of therapy. Evidence of effectiveness is generally associated with improvement in the patient's indication. Therefore, the outcomes of drug therapy can only be evaluated if the practitioner understands the indication of the drug therapy and the goals of therapy. The process of evaluating the effectiveness of the drug therapy requires the practitioner to make judgments about any changes in laboratory tests that might have been abnormal due to the patient's indication. The evaluation of the effectiveness of the patient's drug therapy also requires the practitioner to make judgments about the changes or improvement in the clinical signs and symptoms associated with the indication. These are often the original presenting signs and symptoms of the disease اللي أصلاً patient بيجينا فيهم to begin with, okay, chief compliant. Again, the evaluation of the effectiveness of a patient's drug therapy is based on improvement in the medical condition or the indication of the disease أو initial signs and symptoms اللي البيشنت بيجي فيهم أصلاً presenting to get the medical care. Okay, the process of evaluating the safety, which is represented in the next slide, requires the practitioner to make judgments about the negative reactions experienced by the patient that might have been caused by drug product the patient is taking. So adverse drug reactions that can be caused by the drug itself and are not related to the dose of the drug. For example, an allergic reaction to penicillin is an example of the safety-related outcomes that require the practitioner to make judgment about such negative reaction experienced by the patient. Both changes in laboratory values and changes in the clinical signs and symptoms of the patient must be evaluated to determine the safety of the patient's drug therapy. Negative events, such as the allergic reaction to penicillin that we just mentioned, caused by the drug therapy the patient's taking that result from dose-related actions of the drug are considered toxicity. So احنا ضربنا في الأول مثال اللي هو allergic reaction to penicillins. هاي adverse drug reactions هاي كانت not related to the dose of the drug. إذا كان في عنا negative events caused by the drug therapy that resulted from dose related actions, that this is referred to as toxicity. Pharmaceutical care practitioners consider these two categories of safety concerns separately because dose-related toxicities are most often resolved by changing dosage, while adverse drug reactions most often require discontinuation of the offending or the causative agent. يعني إذا البيشنت مثلا صار في عنده penicillin allergy, it cannot be resolved by reducing the dose, while if the patient developed toxicity secondary to high doses of medication, can be resolved by reducing the dose of the used medication. So we have to consider the two categories of the negative outcomes اللي هم الtoxicity والadverse drug reactions separately because they are different. Evaluation of the patient's outcomes requires the practitioner to collect patient-specific information and to make judgments about the presence or the absence of positive and negative results. زي ما حكينا positive outcomes اللي هو بيكون response that indicates the effectiveness of the used medication, while the negative outcomes indicates safety concern that can be related to the adverse drug reaction or to the development of toxicity بتكون associated with higher than usual doses. Okay, the positive and negative results can then be compared. The negative and positive results can then be compared and evaluated in order to make the clinical decision as to whether to continue with the same drug therapy or to change or discontinue or to switch to another agent. So the two basic considerations of the practitioner throughout the patient care process. So what is the patient care process all about? It is about two main hypotheses or two main questions. Is the patient's problem caused by drug therapy? And or is the problem that the patient is experiencing something that can be treated or avoided with drug therapy? For example, is a patient reports a non-productive cough that has persisted for the past 3 years, the practitioner must assess if this cough is being caused by drug therapy the patient is taking. For example, ACE inhibitors, نعرف they can precipitate a dry cough in some patients. فبالتالي إذا البيشنت ماشي عليهم صار في عنده dry cough, we have to check if the cough is being caused by that medication. And accordingly, you have to eliminate or switch to another class of antihypertensives in order to suppress the cough. Okay. Identifying drug therapy problems was the third step or the third element of patient care process. What do we mean by drug therapy problems? Drug therapy problems are undesirable events or risks that the patient experiences that inhibit or delay him from achieving the desired goals of therapy. What are the components? The components of DTPs include the components of a drug therapy problem include a problem or undesirable event or risk of event, and then drug therapy involved. And you have to establish a relationship between the undesirable event and the used medication. So those are the components of drug-related problems or treatment-related problems. Drug therapy problems constitute a unique set of healthcare problems that is the responsibility of pharmaceutical care practitioner. Drug therapy problems define the unique scope of the practitioner's responsibility. So it's part of your responsibility as a healthcare professional to identify drug therapy problems and central your activities and practice to resolve such identified problems. Drug therapy problems in this slide summarizes the components of DTP. So we will have undesirable event or a problem. The problem can be either in the form of a medical complaint, a sign or symptom, a diagnosis, a disease, an impairment, a disability, abnormality in the laboratory measurement or a value. It can also be a result of physiological or psychological or social, cultural or economic conditions. Okay. Example on a problem, if a patient is suffering an elbow pain that is not being effectively controlled. So my patient is experiencing pain because he is not using sufficient dosages, or he is not using the analgesics in an optimal frequency. My patient is experiencing orthostatic hypotension with mild to light headaches in the morning. Maybe there's a problem with the used doses of the medications. Okay. The second component of drug therapy problem is the drug therapy. The drug therapy that is involved in the DTP. The third component is the relationship between undesirable event and the drug. So is the problem actually a consequence of drug therapy, or is the problem actually caused by the used medication? So you need to add or modify the therapy to resolve or prevent the undesirable event. So if there is an established relationship between the problem or the undesirable event and the drug therapy, then you have to intervene and you have to either add or modify the therapy to resolve or prevent the undesirable events. And this demarcates the responsibilities of the healthcare professional. Other synonyms or other terms that can be used interchangeably with drug-related problems include medication-related problems, pharmaceutical care issue, medical problem. Some people can use the medication error to refer to the drug-related problem, but as we will discuss in the next few slides, DTPs are not a synonym to medication error, since medication errors include or focuses on the prescribing and dispensing accuracy of the used medications. So in medication errors, we have to focus on the 5 rights that we are using the correct drug, the correct dose, the correct route, the correct frequency, and the correct duration of the used medications, while DTPs can be broader terms that include different categories as discussed in the previous slides. As explained earlier, drug therapy problem include 3 components. The problem can take the form of medical complaint, sign, symptom, diagnosis, disease, impairment, disability, or abnormal laboratory measurement, or a syndrome. The second component is the drug therapy or the product or the dosage regimen that is involved in the problem. And the third element is the relationship that exists or suspected to exist between the undesirable event and the drug therapy. This relationship can be the consequence of drug therapy, and if there is an established relationship between the event and the drug therapy, then you have to intervene and you will require to add or modify the used drug therapy or the used regimen in order to resolve the problem. So what are the different categories of DTPs? This table lists the different categories of DTPs that we can face during the practice. Drug therapy that is unnecessary. The drug therapy is unnecessary because the patient does not have a clinical indication at the time of diagnosis. There is no valid indication, or the patient is taking multiple drugs when single drug could work. Non-drug therapy would be better, so lifestyle modifications, for example, or non-pharmacological interventions may be sufficient to get the same benefits. Unnecessary drug can be also in the form of treating an adverse effect of another drug, including over-the-counter supplements or herbal products, through the initiation of unneeded or unnecessary medication. Besides, if a problem is caused by a drug, tobacco, or alcohol use and is causing the problem, then the drug is unnecessary. In the second category of DTPs, we can list the drug that needs to be added. So additional drug therapy is required to treat or prevent a medical condition. So there is a medical condition or indication that requires additional therapy that is not added. So we need to add more medications to treat that condition or that indication. It can be in the form of preventative drug therapy due to risk of disease. So the patient needs actually primary or secondary prophylaxis, but he is not actually taking any preventive measures. So we need to add those medications. For example, aspirin for heart attack أو الstroke. مثلا الكالسيوم for the osteoporosis patient. The patient needs calcium, the patient needs aspirin as he's not using aspirin or calcium, but this problem can be listed under this category. Besides, a medical condition that requires addition for synergy or additive or protective effects may also listed under the drug that needs to be added. In the third category, ineffective or drugs that are not effective implies the drug product that is not being effective at producing the desired response is used. So this is not the most effective drug. The patient is taking one of the drugs that are known to be not the most effective medication or not the first line. Besides, a medical condition may be refractory to the used medication. Example, treating high triglycerides in patients without controlling the blood glucose first. A wrong dosage form, for example, may render the used drug lack of efficacy, may render the used medication ineffective. Okay, for example, the use of immediate release morphine to treat the chronic pain. نعرف احنا immediate release morphine هو بيكون للacute attacks of pain. The use of immediate release morphine for the chronic pain renders this medication ineffective. اوكي لانه احنا اخترنا medication مش مناسب للانديكيشن او للبروبلم الموجوده عندنا. هلا في عندنا drug not effective. For example اذا احنا بنعطي antibiotic والبيشنت في عنده ايش؟ في عنده antibiotic resistance، في عنده بكتيريا اللي بتكون resistant to such antibiotic، ففي هاي الحاله بيكون في عندنا drug that is not effective. الفورث category اللي هو dose is too low or dosage that is too low. The dosage that we are using is too low to produce the desired response. For example, the dose itself is too low أو الانترval بيكون too infrequent. Okay, so we have inappropriate frequency of administration. في عنا مثلا once daily regular human insulin. في عنا drug interaction is reducing the blood levels of the used medication، فبالتالي الدوز بتصفي عندي too low. Example عليها الريفامبين مع الأورال contraceptives. أو بيكون في عنا the duration of therapy is too short، وبالتالي we can list this problem under the lower than optimal doses of medications. The fifth category اللي هي adverse drug reactions. The drug is causing an adverse drug reactions، ومثل ما ذكرنا احنا في السلايدات الماضية outcome أو negative outcome in this case is not dose related. Okay, causes an adverse drug reaction that is not dose related. So there is a safer drug product that is available. في عنا أو عملنا احنا drug regimen changes too quickly، أو صار في عندي example على adverse drug reactions اللي هم allergic reaction. Okay, allergic reaction احنا بنحطها in this category. هلا في عندنا الكاتيجوري اللي تليها اللي هي dosage that is too high. The dosage is too high resulting in undesirable effects. Doses that's too high أو dosing frequency بيكون too short أو the duration of therapy is too long. أو drug interactions that resulted in toxic levels of the used medication أو dose that was given or increased too quickly. In the last category, in non-compliance, the patient is not taking the drug regimen appropriately. But as you can notice, the first 6 categories involve the drug product, while the last category involve the patient. So the patient is not taking the drug regimen appropriately. This can be related to the patient. Maybe there is lack of sufficient instruction. The patient did not understand the given instructions or the patient counseling or the patient education. The patient might prefer not to take the medication. In this case, we have to check with the patient, why are you not taking your medication? Some cases في حالات patients اللي بياخدوا مثلا inhalers في حالات الأزمة ممكن they just refuse to take the inhaler because they have an internal belief that the inhalers can cause can cause addiction. Besides, the patient may just forget to take the prescribed medication, and in this case, we can use the adherence aids, such as timers or alarms, to remind the patient to take the medication as prescribed. Or simply, the patient cannot afford the medication, and that's why the patient is not compliant with the prescribed medication. The patient maybe has problems with dexterity, as we just mentioned as an example for the rheumatoid arthritis patient. The patient is not able to self-inject the prescribed medication, or the patient is simply not able to open up the child-resistant container that contains the pills. So he remembers that he needs to take the medication. He wants and he's willing to take the medication, but he has dexterity problems, or he has a problem that he cannot open up the container that contains the pills. Or simply the patient cannot swallow the tablet, so you have to switch to liquid dosage formulation rather than using the solid tablets, for example. The patient may have problem also to obtain or to find the prescribed product. So when we are stating the DTPs or summarizing the DTP, you have to mention the three components that we have just mentioned: the problem, the drug product, and the relationship or the association between the condition and drug therapy. Okay. Besides, you have to prioritize the DTPs that were identified in the third step of the patient care process. So you have to identify what needs to be fixed immediately. For example, if the patient is suffering a potential harm, or if the drug product is contraindicated in this patient, you have to address this first. Problems addressing a chief complaint as well must be prioritized and fixed. What problems can be fixed directly, and you need to refer the problems which cannot be fixed by yourself. You have to refer to the practitioner or to the consultant who is directly working with the patient. If you are not able to fix the problem yourself, you have to consult and to refer the problem to those in charge. Moving to the medication errors, and as indicated, DTPs are different from the medication error, where the medication error focuses on prescribing and dispensing accuracy. So under the causes of medication errors, we can have issues that are common to all healthcare providers. We can have specific issues related to specific prescribers, or we can have specific issues that are related to the pharmacy and the site of practice. Generally speaking, the causes of medication errors can fall in one of three major categories. So it can be related to the patient characteristics, such as the age of the patient, the type of the procedure that's being done, and the physical status of the patient. So you may find some patients prone to medication errors more compared to other patient population. For example, دايما نحكي عن الجيرياتريكس اللي ماشيين على polypharmacy who have comorbid diseases, multiple comorbid diseases, who are using multiple medications, who are on polypharmacy. They are prone to medication errors compared to other healthy adult population. This is the first category. The second category under the causes of medication errors include the environmental factors. For example, the workload, the type of work, the transfer of the medications, or the flow of work between different settings or contexts, and the type of the surgical procedure, for example, done. The third category include the human factor, which may involve a lack of knowledge or experience, or the level of fatigue and stress a healthcare provider may be experiencing. And this can lie in the issues that may be common to all healthcare providers that are listed in the next slide. Factors that can contribute to the errors are listed in this slide, and they can fall in one of the three categories that we have just mentioned, either under the patient characteristic, the environmental factors, or the human factor. So there is lack of sleep, fatigue, illness, there is drugs or alcohol, boredom, frustration, fear, stress, distractions, noise, temperature, motion, and lighting can be either related to the human factor or to the environmental factors. Besides, all healthcare providers can be involved in medication errors if they are not able to keep up to date in the information, if they lack sufficient and effective communication with other members of the team, if they are burdened with the volume or with the workload and they lack sufficient time to dig deeper into the root causes of different medication errors. If they lack the knowledge about medications, if there is inadequate patient information, and they do not have enough time to get or collect sufficient data or information related to their patients. Besides, poor labeling or packaging interruptions and manpower shortages can also lead to medication errors. Handwriting is a major cause of medication errors. Many of the physicians were asked to go to handwriting schools, and there is a talk about stopping in handwriting and switching to automated or electronic prescribing. Besides, verbal orders can be problematic, especially in sound alike medications. So the prescriber may ask the nurse to transcribe a certain medication, and she might hear something else, and then she will add inappropriate medication to the prescription, and the patient can get inappropriate medication or unintended medication secondary to such an error. Causes related to the pharmacy, as we just mentioned, may be related to the dispensing procedure, to the dispensing measures that are followed by the system, to the errors in calculation, and to errors related to lack of patient counseling or lack of patient education. The most common one in pharmacy is the wrong dispensing, the wrong strength of different medications. As we've just mentioned, the sound alike, look alike medication may be an important stem or an important stem of different types of medication errors. For example, we have a couple of listed medications in this slide. Zyprexa and Zyrtec, they sound alike medications, where they are actually different, two different medications. Olanzapine is an antipsychotic medication that works by changing the actions of chemicals in the brain. Olanzapine is used to treat the symptoms of psychotic conditions, including hallucinations, delusions, and confusion, while Zyrtec is the brand name of cetirizine, which is an antihistamine, and antihistamines are used to treat different allergic symptoms. So if the patient got Zyprexa, which is olanzapine, instead of Zyrtec, we are putting the patient at risk for different side effects that can be induced by olanzapine, where the patient is actually suffering or needs only an antihistamine to treat allergic reaction. Another example is lavoxine and lanoxine. Lavoxine is the levothyroxine, which is a naturally occurring hormone that is used to treat hypothyroidism or low thyroid function, and it's used to prevent or treat goiter, while lanoxine is digoxin, which is a cardiac glycoside that is used to improve the contractility and the efficiency of heart pumping. So it's associated with numerous side effects compared to a patient who has hypothyroidism and needs levothyroxine to treat the condition. So those are a couple of examples about sound-alike medication and how dangerous it is to get such medication mixed and given inappropriately to different medications. Moving to the risk reduction strategies, we can adjust the storage process of different medications, and we can ask the prescriber to provide both the generic and brand names of drugs as a measure of double checking of the intended medication. We can also ask the prescriber to write the purpose of the medication on the prescription or the medication order. We can also develop a policy for taking verbal orders or telephone orders, just to make sure that we do not get those sound-alike medications mixed up. Always, if you are not sure about the prescribed medication, you have to double check and verify the actual intended medication. Never try to guess which medication the prescriber was asking you to transcribe using the verbal or the telephone encounter. Never abbreviate the drug names, and develop a list of unacceptable abbreviations and symbols, and you have to share with the staff in order to avoid the use of such abbreviations to prevent medication errors. Besides, we can develop a policy so that the medical staff will not use unapproved abbreviations. It's also advised to establish the policy that if an unapproved or unknown abbreviation is used, then the prescription must be verified by the prescriber before dispensing. An example about the risky abbreviations that must be added to the policy of unacceptable abbreviation is the use of U for units. The U can actually look like a zero and lead to duplication of the prescribed or of the intended dose. Besides, QOD, which means every other day, looks like QD, which means actually every day. So instead of taking the medication every other day, the patient may be directed to take the medication every day. And this is one of the risky abbreviations that must be avoided. Another example is AU, which means both ears, can look like OU, which means both eyes. So instead of using the eardrop, the patient can use it in the eyes. And remember, eye drops can go into the ears, but eardrops cannot go in the eye because you need steroid products to go in the eye. In the last slide, lists also an example of the risky use of the decimal points. You have to be careful with the leading and trailing zeros when you are using or when you are ordering medications using the decimal points. Examples of correct and incorrect use of decimal points and zeros. For example, it's okay to use 2 to indicate the needed dose, but do not use the trailing zeros. Do not use the leading trailing zeros to the right of the decimal point, because it might be misinterpreted as 20 instead of 2, which is 10 times higher than the intended dose. Besides, if you are ordering 0.2, it's correct to write it this way, and it's incorrect to write it without the leading zero before the decimal point, because it can be misinterpreted as 2 rather than 0.2. So you have to use the leading zeros before the decimal point and avoid using the trailing zeros to the right of the decimal point. Good luck.